welcome to Therapy Clarity. So we've talked about EMDR, but can you tell us what EMDR stands for?
Sure, it's eye movement desensitization and reprocessing therapy. And it was first invented, I guess you would call it, by Francine Shapiro. And Francine had noticed one day when she was going through a hard time and walking through a park, that as she was thinking about the difficult time that she was going through, her eyes actually just moved back and forth, back and forth, back and forth. And as she continued to focus on this difficult, challenging thing that was in her memory banks, and those eyes moved back and forth, she noticed that it became less vivid, that her emotions changed, that she was able to tolerate it a little bit better and calm down. And then she started to think, well, I wonder if there's something to this, right? And because she was taking a PhD, she was able to do some research on eye movements and to see if that made a difference for people when they brought up their own challenging, difficult situations from the past. So as you bring up something that you want to reprocess, so you bring it up in a way that it activates the image that goes with it, and maybe even the worst part of it, the belief that you have about yourself as you think about this time, and then the emotions that you're feeling now and where you feel that in your body. And we start doing eye movements. So sometimes therapists will move their fingers back and forth and you would follow the fingers, or we might have a light bar in our room where you follow the light back and forth, or a dot on a computer screen that goes back and forth. Those are all eye movements. We would do that for about 30 seconds or so, and then stop and have somebody take a breath and notice what they're noticing now, whatever that might be. And what they're finding now in some of the research that's coming out with some brain imaging studies is that the eye movements actually ignite or activate parts of our brain that are dormant or completely asleep when we bring up traumatic memories. So because we can activate parts of the brain that normally aren't awake when we're re-experiencing bad stuff, right? We're able to process it. So there's different parts of the brain that do come online: the prefrontal cortex, the left side of the brain, the visual spatial sketch pad, a whole bunch of other important sounding structures in the brain, right? Come online. But the basics is that if you keep the memory that you're processing in mind, okay, and we have the image up in our brain and we're thinking about it and feeling it in this moment, and then we add that stimulation, the eye movements, for example, it does a couple things. It taxes our working memory, it helps to move that memory a bit, and it decreases the vividness of it. So when we decrease the vividness of that memory, the emotions that are associated with it go down as well. And then we end up getting to a place where we can think about the memory, but not feel distressed by it, right? And when we get there, then we actually install a positive belief about yourself that you'd like to believe about yourself as you think about this memory, and all of the body felt sensations that go with that positive belief as you say it and link it up to the memory. And we install that with sets of bilateral stimulation, or those eye movements. And then we just focus on the body. We scan from head to toe. So as you bring up that memory and that positive belief, what do you notice now? And usually we get to a place where it feels comfortable. So this awful bad thing happened, and it will always be bad, right? But when you think about it now, it doesn't disturb you anymore. And I think that's where you got to on your hardest memory to process.
Yes, I definitely did. And I remember that exact wording, as we had chatted through our sessions, was you sort of distinguishing between the thing, which is awful and always will be awful. But at the end, it wasn't distressing to me. And, just listening to you go over it again, I'm finding myself kind of reliving some of what we did, and it was astounding to me, Kelly, how easy it was for me to go back and to have a memory. And, so these weren't memories that I'm thinking about every day or that I've probably even thought about it in many, many years. And yet when, as we went back, sort of following this thread, I could find a memory. There was a memory there. And that was kind of, fascinating to me, that I didn't struggle going, "Well, I don't know. I don't remember that ever happening." I definitely had that memory. So where I remember we started with me, I believe the first question, or one of the first you asked me, is what's the worst part of what you're experiencing right now? And I had said, I've lost my self-confidence. So that sense of self seems gone. And that was kind of the thread we followed. So it was like, when was, the most recent time you remember?
Exactly. Yeah.
Yeah. And then we went all the way back to when I was a child, which was just remarkable, I thought.
Yeah. In
Yeah.
EMDR therapy, we have a model that helps to explain it for us called the Adaptive Information Processing Model. And what the AIP model, Adaptive Information Processing, tells us is that, first of all, humans always move towards health, physical or mental health. And we can trust our brain is always going to try and do that when it can do that. But when trauma occurs, something really adverse or negative happens to somebody, and it doesn't necessarily have to be a trauma. I mean, you could receive some criticism from somebody or be embarrassed in a certain situation, be bullied, maybe not to a level where it's life-threatening. But these negative or adverse experiences impact us over time, over our life, especially if we don't process them. So when something really awful happens, our information processing system gets blocked, the way that we naturally process information, right? Through often even our rapid eye movement sleep during one of our sleep cycles. In rapid eye movement sleep, we're taking that information that we've gathered from our day, from our week, and our brain is trying to process it and link it up to other like experiences in our brain that we hold maybe in symbolic file folders, for example. And so for
Right.
most things, it can link up information, right? So you learn something new about a lizard. It's going to pull out the reptiles file, put that new fact about a lizard in the reptiles file. Off we go to the next thing that needs to be processed or linked up in information in our brain. But when it comes to trauma, it can't link up to anything. So it floats around in our brain, ready to be triggered at any time. It's almost like a snapshot. So you think of a, snapshot that we print out, or now we have digital copies on our phones or computers. But a snapshot kind of has that image on it. But when you look at a snapshot, you also get the emotions that are associated with that snapshot coming up, right?
Yeah.
Some body sensations that are associated with it, your thoughts about yourself and the world. Okay, so it's those
Yeah.
3 levels of the brain, all stored along with our sensory information, so our 5 senses, on that snapshot. So if we have a bunch of those snapshots scattered around and not put into file folders, that means they can get triggered in the now, in the present, right? So
Yeah.
even though you hadn't thought about those memories that were disturbing to you, you hadn't thought about them in a long, long, long time. You had something happen in the now that triggered that snapshot coming up to the surface again, right? And
Yeah.
once it was there was no putting it back until we processed it.
Yeah. And that is exactly what happened in March of 2020 when I got a phone call from a friend that her son had just died by suicide.
Mhm.
And really from then on, I just got sick, and I again didn't know. Uh, and I certainly was aware I had this experience of suicide in my life over 30 years ago. Um, and I knew that was awful. I really thought I was, I had done some work on that. But wow. And I literally felt like every part of me shut down. Definitely my brain wasn't working properly. I lost a lot of weight. It was just nothing worked. I couldn't function really. And I remember you telling me about the snapshots, Kelly, and I loved that so much. That visual worked so well for me. Imagining because when I thought of those other memories, that I had, the one when I was 6 or when I was 10, or, just other memories that were just normal moments, in anyone's life, but yet I had told myself certain things at
Mhm.
at that time, and felt certain things, that it was like all those snapshots, I was I felt like I was overwhelmed by all of them. And when you described it to me, I remember I saw them as little floating tissue sheets that sort of came flying at me, but it was the same. It just made so much sense to me that that is why, I it happened so fast, and I was, so unwell.
Yeah. So
And
what you're
yeah,
describing there is that when we have similar things happen to us, right, over time, they kind of link up together. There's like this thread that goes through and connects all those different snapshots. So when we light up one, that whole network becomes lit up. So it can be very powerful if you've had a lot of those types of experiences in your life, right?
yeah,
So when you
totally
came
makes
in,
sense.
yeah, and you alluded to this just a little while ago, but when you came in, we did start doing some grounding for you, some coping strategies, but then we needed to figure out, what do we need to process, right?
Yeah,
So I just simply asked you, what's really bugging you right now? So you mentioned that symptom of that lack of confidence.
yeah,
So we use a technique that helps you kind of get past your conscious layer of understanding, and it helps you go into the subconscious. So stuff that you wouldn't necessarily tell me about, because you wouldn't
mm,
think it would be relevant, maybe, or and maybe it just didn't occur to you to tell your therapist, right? But I get you
right.
to think about the last time you were feeling that lack of confidence, and light up those three parts of the brain. So what were you, what's the image that goes with that? What's the belief about yourself that goes with that? A negative belief. What emotions do you feel now as you bring that up? And where do you feel that in your body? And when we just kind of float back through time to other times when you've also experienced that, what are we doing? We're lighting up that memory network, right? So the
Mm,
thread is lighting up and finding all the snapshots that go on it. And that's when
mm,
you started telling me some of the things in your life that you said were more normal kind of experiences, but obviously that had been impacting you over
yeah,
time because you'd held on to them. They weren't processed yet, even though they were just regular kind of life experiences, right?
yeah, right.
And so actually the first memory, or the earliest memory that you identified, doesn't seem like a trauma memory at all, right? But we needed to process that one first because it set the foundation for this whole memory network, all the snapshots connected on the thread. And once we processed that memory, then we went to the more challenging, difficult memories.
Yeah, yeah. It does make so much sense now, and as as you describe it that way, and I remember us when we went back through that network, that memory network. There were some memories we got to, and through fairly short discussion, it wasn't it wasn't one that was, we needed to process. Like, so I can't remember exactly how we determined that, but I think it was, you would ask me some questions, and you also used a bit of a number scale from time to time,
Yeah,
sort of from some 0 to 7. And so it might have been based on my response there, to those questions. But I remember we definitely did not process every single, or have to go through the detail. Yeah.
no. And for a lot of people, we really just have to process the earliest or the youngest memory, and then the kind of the most um, impactful memory, right? The one
Yeah.
that's really troubling you, even though maybe even a long time has gone by. So
Right.
it's those two from the past, and then anything else we need to clear up. So we kind of just check in with those memories. And we use two scales in EMDR therapy. One is called the subjective units of disturbance scale, and it's a 0 to 10 scale that just measures simply your distress or disturbance in this moment as you bring something up. So 0 is neutral or doesn't bother me at all. 10's the worst you can imagine feeling. Okay. And so
Yeah.
if you bring up a memory and we again light up the three parts of the brain and you're not feeling any distress, well, that one's processed. We don't need to work on that one.
Right.
Right. But if you're
Yeah.
feeling some distress right now as you think about it, even though this happened, a long time ago, well, then that's something that we should probably work on, right? Then
Yeah.
we have this other scale that measures our positive belief with the memory. So how much do you really believe this positive belief as you think about that memory now? And that's that wonky scale of 1 to 7, where 1 is completely false and 7 is completely true. So as you bring up that memory and the positive belief of I am competent or I'm confident, for example, how true does that feel to you right now? And so 7 would be completely true.
Yeah. But thanks for joining us.
Thank you.